It's a privilege and honor to introduce our speaker for today, Dr. Jayanthi. As we all know, she's the Dean of the Government Medical College, Omundura. Academically, Dr. Jayanthi did her undergraduation from the Government Stanley Medical College in 1986, followed by a post-graduation MD from the Government Keele Park Medical College 1993. She has had fellowships from FRCP Glasgow, FRCP Edinburgh, and FRCP London. A lot of teaching experience, nearly 30 years, and 6 years of administrative experience Dr. Jayanthi has. A number of publications to her credit, including 24 original research papers in various reputed indexed national and international journals. Dr. Jayanthi has participated and presented papers in national and international conferences, authored chapter on Manual of Hypertension HIS in 2015. A recipient of many awards, the Best Performing Dean Award by the Government of Tamil Nadu 2018. She's had the Medical Personality of the Year by FICCI and the Tamil Nadu Highways Department 2018. Followed by the Professor M.S. Ramachandran Oration Award and Medal in 2019. She's had the Best Performance Award from NHM Government of Tamil Nadu 2019. Nalam Awards, Service Excellence, Public Sector by News Channel, Tamil Channel 2019. CAHO Award for the Best Hospital 2020. Medical Excellence for Outstanding Contribution to COVID Management by the World Tamil Conference. Indian Medical Association 2020 Best Administrator. And very recently, we had the honor of giving her the Occasional Service Award 2021 on the Doctor's Day by our club, Rotary Chennai Central. And I now request Dr. Jayanthi and hand over to you, Harish. Let's hear Dr. Jayanthi come.
Over to you, ma'am.
So very good evening and அனைவருக்கும் என்னுடைய மாலை வணக்கம். I will keep it very, very simple. I have a very short PowerPoint to make. And after that, I will of course be answering your questions if you have any. And before I start, my profound gratitude to every one of you, especially the office bearers of all the Rotary Club, Mr. Ramesh Kumar in particular, Mr. Surya Narayan Rao having introduced me, and of course to Mr. Abhirami Ramanathan, who's going to felicitate me, and I have to have a special word of thanks for him. I take this opportunity to thank him for having given us 22 lakhs to buy equipments. I'm sure it will come through shortly. So I express my profound gratitude and thanks to him. I use this platform for this with your permission. So I begin now. So I've been asked to talk about COVID awareness, the third wave. So as you all know, COVID has been the word on everyone's lips for the past 1.5 years. And we've been living through the thick and thin of Corona, day in and day out. To start with a bit of humor, this was one of the memes I really liked and laughed out. So Corona-வுக்கு இரண்டாம் அலை மூன்றாம் அலைன்னு பேர் வைக்கிறதுக்கு பதிலா மொத்தமா அலைகள் ஓய்வதில்லைன்னு வச்சிடலாம். So this person, this comedian, I think has had a great influence in our day-to-day life. Not a meeting, not an interaction has gone without using any one of his punchlines. He's an all-time comedian, a very great comedian, whom I've always admired and adored. So even though it is humorous to read it, but there's a lot of fact into those lines. Corona has not gone away, that all of us must learn and get to terms with. It is here to stay. So all this first wave, second wave, third wave are all just semantics. It just spurts and spikes whenever it finds the time and place conducive for it to thrive. Otherwise, it remains silent amongst us, within us, as one amongst us. So that is a fact. Therefore, talking about a first wave, a second wave, and third wave are all just semantics. And before I could talk to you about Corona itself, I'll have to the reason for these waves. Why should it come in wave forms? There are three important factors which influence a formation of the so-called wave. First of all, it is the immunity of the people. So that is why we saw a first wave which was spread across the world within a very short time. From the time it was reported in the Hubei province of China, in Wuhan, in the late, almost end of December 2019, and by January, February, March, May, it had spread across most of the world. That was because it was a new virus and people did not have immunity. And later, as you can see from our own experience, the second wave struck us. That was again because the second reason, which is formation of a new variant. People were immune to the first type, but there was an emergence of a new variant called mutation. Mutation itself is one of its ability to adapt, to change, and to strike. So therefore, formation of new variants is another reason for a wave to come on. Of course, COVID appropriate behavior or the lack of it. If all of us were to follow the COVID appropriate behavior properly, I can assure you a wave is unlikely to occur. And even if it occurs, it's not going to be a magnitude of serious importance and significance. A COVID appropriate behavior is of paramount importance in letting a wave not to occur or it. So that is why people and media scream all over the world about COVID appropriate behavior. Next one, please. So, a short recap about this coronavirus. It is an RNA virus. It looks very beautiful. The word corona means, as all know from the word coronation, those spikes on its surface are like the spikes that you see on the ground. So it's an RNA virus which spikes on its crown. And originally in the Wuhan province, it was named as the COVID-19, going by the year that it came. And it was a novel coronavirus. Coronaviruses are not new. They have been there for ages. This particular virus was called a novel coronavirus. And then later on, all international bodies gave the new name of SARS-CoV-2, which means a syndrome of acute respiratory distress due to the coronavirus too. Next one, please. How does it spread? We all know that it spreads by droplet from the infected persons. If a patient breathes or talks, he can give out millions of viruses in his breath. Also, when they laugh or sing, and they cough or sneeze. So these are the ways by which the virus comes out of the oral cavity, where there's saliva and all oral secretion teeming with these viruses. So person who's nearby, that is within 2 meters, these are supposed to be large droplets. Originally, that was how it was thought, large droplet infections. So these droplets were laden with these viruses. And once the person next to the infected person inhales these viruses, then he is infected. But now we know there's a lot of evidence that it is in the air itself. It is aerosol driven. So therefore, the modalities of infections are changing much as the virus itself. So this is the the dynamics of the spread. As a person gets infected, you have 2.5 people infected after 5 days. And after a month, it multiplies and becomes 406. This rate of infection that you can see is called the R0, or the rate at which the virus can multiply and infect people. Now we know that an R0 of less than 1 will not cause serious disease of epidemic proportions, but anything that crosses above 7 or 8 will lead to what is called a wave. That is, many cases occurring at the same time. So now you can see the symptoms. I'm sure all of you are familiar with this. Cough is a predominant symptom. Breathlessness, that is being short of breath. Headache, body aches, loss of taste and smell was seen in the first infection. Now the second one, the Delta variant, we have not seen much of this loss of taste or smell. Instead, diarrheal symptoms were predominant, namely nausea, vomiting, and there was also sore throat congestion in both the forms. But as you can see, the second wave, the viruses behaved very, very differently from the first wave. We had very short incubation period. We could see clusters, family members getting affected in a very short period, and then progression to lung involvement. That is the manifestations of lung disease, namely breathlessness and cough was much more than what we saw in the first wave. Next, to talk about who are all prone. So this also, I'm sure most of you know, people with comorbidities, conditions, lifestyle diseases like diabetes, high blood pressure, heart and lung problems, obesity. Obesity is one thing I have to underline here and tell you. We have seen, it's our own personal experience, not just in Tamil Nadu or India, the world over, people who have been obese have taken the major brunt of the disease. There has been a high mortality, death rate among people who have been obese. And so are people infected with other comorbid conditions. But again, the second wave changed all this. We could see young, robust individuals between 20 to 30 years, between 30 to 40 years being affected. People without comorbidities also got affected. So that is how the virus adapts itself by mutation to change its pattern of manifestation. Next one. So these are the treatment. All of you, I'm sure, are pundits by now about the treatment modalities that we doctors offer. Supportive oxygen is the mainstay when there is lung involvement. Steroids also play a very useful role. Antibiotics, wherever it is warranted. And otherwise, it's only symptomatic management. I'm just touching upon the gross, just a recap about what you already know. It's just a quick recap. Next. So this is how do you protect yourself from the COVID-19? Of all the slides that I'm going to display today, I would call this the most important one. And you know, this is the secret. These three methods, these golden rules is the only gold standard for preventing COVID-19. And you all know that prevention is any day better than cure. So therefore, the three cardinal principles in preventing COVID-19 would be mask, social distancing, and soap and water wherever available, sanitizer in the places where soap and running water is not available. So it is, even if you have to repeat 1,000th time, it's worth repeating and reiterating the importance of these three measures. This is also called social vaccination. So talking about social vaccination, we've come to vaccination. As you all know, vaccination started only by January of this year, and by December in the rest of the world, December 2020, January 2021, we rolled out vaccination in India. Thanks to the efforts, now we have covered about less than 10% of the Indian population. It's going to touch about 10 to 15% shortly, but at least we have done that. Even though this talk about vaccine hesitancy, of vaccine non-availability, still we have got enough and more reports and results that vaccine are extremely useful in not only prevention, but also in containing the seriousness of the disease. Therefore, vaccination has proven as a cornerstone in COVID, containment of COVID. So I'm sure most of you have doubts about COVID-19 in children. This is what is being talked about in the third wave. So coronavirus symptoms in kids can definitely differ from how it manifests in adults. So it can just pass away as mild fever, cold, cough, like any other acute infection that you commonly see in children. Just fever, child could be fatigued for some days, can have headache, muscle pain, cough, little nasal congestion, stuffy nose, can complain of little sore throat. But it is rare to cause pulmonary involvement, that is lung involvement in children. There's another disorder called MISC, multi-inflammatory syndrome, where multiple organs go into inflammatory state, and there's a drop in BP, and there is a collapse of the child. So that is the more dreaded event that we see in COVID, unlike in adults. And as in adults, children with comorbid conditions are more at risk, especially those with heart, liver and kidney disease, diabetes, obesity, asthma, chronic pulmonary obstructive disease, and other blood disorders. And of course, immunosuppressed individuals, children who are on steroids, or children who are born with less immunity, they are more prone, just like in adults. Next. So COVID-19 in pregnancy, again, I'm sure most of you will have doubts about this as well. So COVID-19 in pregnancy caused a lot of deaths in the second wave, especially. And we saw preterm births and stillbirths, a lot of fetal loss as well. And there were a lot of maternal deaths as well in the second wave, unlike in the first wave. There's incidence of high BP, which is called preeclampsia, more in pregnant women who are affected with COVID. There's increased chances for C-section because the child goes into fetal distress. And to save the women when there's lung involvement, they often resorted to the C-section. So it had caused havoc in pregnant women, especially the second wave. So thanks to the timely efforts world over, and thanks to the efforts by the ICMR in India, vaccination is now started for pregnant women also. That comes as a very good news. So across trimesters, they can be vaccinated. And there are no big contraindications for vaccination in pregnancy, and vaccination has been found to be safe so far and so good. Next. So COVID-19 in lactating mothers, this breakthrough came much before the vaccination could be advocated in pregnant women. So lactating women were given vaccine much before pregnant women could be administered. There's very little evidence to show that the COVID virus could pass through the milk of the mother into the fetus. But however, it is prudent to practice all the hygiene that we generally practice against COVID, namely wearing masks, washing hands before and after touching the baby, routine cleaning and disinfecting the surfaces. So these are the safe practices that need to be followed, like for anybody else. So we need to talk quickly about vaccination in COVID-19. As you know, earlier on, we had 2 vaccines made available in India, even though world over, there are close to about 15 to 16 types of vaccines that are being administered across the globe. In India, thus far, we had 2 vaccines. The third one has joined the line now, that's Sputnik. And the fourth one is almost around the corner, and you all would have read it in the papers yesterday that the Johnson & Johnson has been given a clean sheet, which is a single dose as against the double dose of the 3 vaccines. And vaccination has proved beyond doubt it's the safest and the most effective method for prevention of COVID-19 infection. There are large-scale trials world over and in India also about the safety of COVID-19. But the catch here is vaccine might not prevent you from getting an infection, but if at all you get an infection after the 2 doses of vaccination, it prevents you from getting seriously ill, it prevents you from getting hospitalized, and it prevents you from getting into an ICU and getting hooked to a ventilator. So these have been proven facts world over. We have our own studies as well in our own institution. And for COVID vaccination is the ultimate in escaping from morbidity and mortality due to COVID-19, which is what all of us dread. So, but then that is just not enough. We need to still practice the SMS, namely the safe hands, masking, and social distance. So having talked about vaccines, you will want to know what are the rules and regulations that guide vaccine administration. Covishield has to be administered in 2-dose regime. in 12 to 16 weeks interval, and Covaxin is much shorter, 4 to 6 intervals. And Covishield is a viral vector added vaccine. Covaxin is a heat kill vaccine. The entire virus is heat kill. That is the technology that Covaxin uses. Covishield is what is called a virus vector. An adenovirus that normally affects the chimpanzees is used as a vector, part of the virion, that is a certain protein part of the COVID-19 virus is injected into that adenovirus, which in turn is made as a vector and is injected through the vaccine into adults. Next. So when can you take, supposing you had a COVID-19 clinical disease, you develop antibodies to that. So when is it right time to get yourself immunized after that? The recommended interval is 3 months or 90 days. So you don't have to be complacent saying that I've had an infection, so why should I take a dose of vaccine? This natural immunity that you get because of antibodies formed due to a natural infection will not very last. Even though we do not have solid studies on how long it lasts, we have enough proof to say that vaccination after 90 days, that is after 3 months, is going to boost up your immunity and keep it more long lasting and more steadfast. So this COVID-19 vaccine, I don't think any other vaccine in this world would have faced this much of that is so the myths, we just go quickly through the myths and facts. So will COVID-19 cases increase as the vaccines start rolling out? Once the second wave hit India, people started telling that it was because of the vaccine that we had a second wave, which is definitely a very, very wrong notion. Vaccines, as you know, they work, but they only work with other preventive measures. So therefore, at the beginning of the second wave, we had very few people vaccinated. And the second wave, we all know, was because of the Delta virus, which was not the original virus that came in the first wave. And very few people also comparatively had a natural infection. So that was the cause for peaking of the second wave, and not because that started in say, January to March. The next misconception about the next misconception was the person who receives COVID-19, should he quarantine for 14 days like when they get a natural infection? No, definitely not. Because none of the COVID-19 vaccines that you know have a virus. So therefore, there are no chances that the person who takes the vaccine will be getting the virus. Therefore, that is also a myth and is a misunderstanding that they need to be quarantined. The next is, of course, about should everyone get tested by a PCR before taking the COVID-19 vaccine? No, it is not at all needed. Even if you happen to harbor a silent infection, it is perfectly all right to take a COVID-19 vaccine because it just does not harm the people, and it does not if you are in the incubation period or if you are harboring the early stages of infection. So testing for COVID-19 infection before vaccination is certainly redundant and not necessary. The next is people COVID-19 must get a vaccine. As we have already told you, COVID-19, when it comes as an therefore, you can wait for 90 days safely before you take your dose of vaccination. So this is the next myth. Can COVID-19 vaccine, if I have just received a vaccine for another disease, can I take a, it's a very, very clear question, very reasonable one too. Can I take any other vaccine if I've taken a COVID-19 vaccine? Yes, you can take, but it is safe to leave a period of 14 days before an optional vaccine. But if it is an emergency, like say rabies, if you've had a dog bite, then it is safe to consult with your doctor and decide on the period of interval before you can take. Toxoids are generally safe. That means toxoid that you take after an injury, all that is safe. But it is only the live attenuated vaccines which are given as an optional form. That can be given after a 14-week interval. So this is a very, very famous, should I say, myth or a question. Torments people. Can alcohol be consumed? Can non-vegetarian food be consumed post-vaccination? There is no proven evidence as yet about linking both alcohol and non-vegetarian, non-vegetarian around time. Certainly not. But as a word of caution, we generally say alcohol binging is really not advocated because, as you know, alcohol binging can suppress all your senses. So if at all, by any remote chance, if your vaccine is going to cause any kind of late reaction, you may not be in a position to probably prudent to avoid alcohol just around the time of vaccination. As far as non-vegetarian food goes, definitely there is no association between non-vegetarian food and vaccination. So I think I've come to the end of a very short glimpse, a bird's eye view about the corona as a disease, its symptoms, and about the preventive measures. Dr. Ramesh had requested me to talk or touch upon certain, aspects. One of them is, of course, how did we prepare ourselves at Omundura Hospital for the second wave? So we had very short time with we had to manage. And these are some of the best practices that I'm going to show you from our hospital, which we did. It was a Herculean task. Ambulances with their siren blaring, lining our lobby, and then patients in wheelchairs in every conceivable mode of transport, just pouring in, all of them breathless, panting for oxygen. And all of us in PPE gears, sweating it out, day in, day out. Looking back, we are really amazed at the volume of work, the magnitude of work that they had done, and how we geared ourselves up. So we started with 575 beds. This is, as you all know, it's a fledgling hospital, and like the other hospitals in the city. So we had a capacity of 575 beds, which went up to 700 during the first wave. Then we had to dismantle all of them because we really didn't know if the second wave would come. So we had to get back to a routine, and therefore we went back to our 575 strength. And within 2 weeks, we doubled up the capacity. And there you can see the pictures. Every conceivable place in the hospital became a ward. Quickly, we were burdened with, thanks to the efforts of good-hearted citizens like the people I'm addressing. All of them pumped us with generous gesture of donating cots, mattresses, concentrators, you name it, and we had it. So therefore, we could create double the capacity from 575 to 1020. Then you can see a makeshift tent, 300 beds, all with concentrators. Our own children's examination hall was converted into, that's what you see on the other side of the picture, it was converted into a ward. So more pictures that you can see. So there you can see the oxygen triage, because it was so these are the pictures of the triage that you're seeing. These were outpatient rooms that we converted into triage, and these are the oxygen clinics, we call them, so that we could keep them, and these are the DTAP cylinders straight onto the walls. So whichever we created was just not enough, so we had to keep on doubling. These were the makeshift tents. You see the patient load there, and these are the tents that we use the floor. There's a huge open space by the side of the towers that you see. We made these makeshift tents thanks to CRIDI, which came in handy and gave us all these tents and fully equipped. and the previous one. So this is the oxygen concentrators that was given aplenty. We could source near 500 of them, which came in very, very handy to patients, because even though we have a large liquid oxygen plant, it was a nightmare for us when it ran out, and these were the machines that came in handy. Once again, I acknowledge with gratitude the many Rotary clubs which came in and gave us these concentrators. So we made our own innovations. That is, we could connect two 5-liter concentrators and make a 10-liter out of it. And similarly, we could divide one 10-liter into two. So those were the innovations that we did at Government Omundura Medical College Hospital. Here you can see that how we made innovations of concentrators. So one 10-liter could be shared by two, and two 5-liters could be connected and given to a single person. So these were the innovations. And then we had, as the center of the control activity, a central control room, which tackled the calls 24/7 and made all arrangements that was necessary. This was the nerve center of the entire activity. So these are the outpatients. This is a relatively free that you see. It was packed with patients throughout. We had about 100 capacity outpatients, always packed with the patients. And these were the innovations that we used in inpatients. This was a digital monitor, a non-touch monitor, which could be controlled by remote. So doctor could sit outside the ward and see the patients. He could even sit at home and take the readings from these monitors and have a note about the patient's condition and all medications as well. And these were the very much simplified robots that were used to supply food, sometimes newspapers, and even medicines to the patients. And the one such, another innovation that we made was the helpline desk. This was given a lot of credit in the media as well. So we had a patient desk with a giant LED display. Here you can see the volunteers from the Banyan came, chipped in, helped us to give the details about the patients in the ICU so that it could avoid the patients' attenders from going in and getting themselves infected and carrying the virus. So this was much loved by the media. This was the first of its kind in Chennai hospital, and other hospitals followed suit. You can see the details of the ICU patients here, manned by the volunteers from the Banyan. And not did we stop with just the conventional allopathic treatment. We also did a lot of yoga therapy, not just for doctors, but also for patients and other in tackling the COVID. So these, and we also had very nutritious food supply to our patients. So this is some of the IEC materials that we displayed. It's still on display outside our gate. We proudly display, and the importance of masks. This is a giant model out of fiber, and this was a logo with a wear mask, be ahead. This still continues because this is very relevant even today. So after the COVID started, we now have state-of-the-art post-COVID care center, all under one roof, where we give all the services to screen the patients who have recovered COVID. So this is a post-COVID center. I would invite all of you who have been down with COVID or whose relatives or anybody who has had COVID to please take this service absolutely free of cost. We have a state-of-the-art facility here with a very, very rich and very pleasant ambience. And this is part of that, the COVID yoga center, post-COVID yoga center, where there's a yoga teacher who teaches the yoga therapy for post-COVID patients. So the adding feather, one more feather to our cap, the recent one is our preparedness for the third wave. I hope and pray that we don't put this to use at all. Here we have a pediatric ICU, which is very, very state-of-the-art again. We have 16-bedded ICU. Each of them has a ventilator, a defibrillator, cardiac monitor, fully equipped, state-of-the-art, and ambience is enriched with cartoons so that children do not feel the pain and they have the feel of being in a nursery rather than in an ICU. So we lots of efforts and pains. Again, thanks to one of the Rotary Club of Tinagar, which has chipped in partially for sponsoring this, and it is a waiting inauguration. Next. So this is the nutrition that I was talking to you about, and there was a lot of acclaim for this, both in the social media, by all patients, and we had mails pouring into our email ID about how they relished the food when they were in patients here. And this is the traditional, the Kabasura Kutinir and all those health drinks, not just Kabasura, but all other health drinks also, which we served timely to all the patients, and all of them absolutely free of cost. So we had treated more than 1.02 lakhs of patients in the past 1.5 years as outpatients, COVID outpatients, and we have treated 56,000 inpatients in this hospital in the past 1.5 years. And we have a recovery rate of 98%, and all of them. Then more important is patient satisfaction. I'm sure we scored very high in patient satisfaction. So Mr. Ramesh also wanted to touch upon the precautions to be taken by the public to avoid a third wave. There's nothing really new to talk about in avoiding a third wave. We all know only 3+1. That is 3 COVID appropriate behavior of social distancing, hand washing, and masking. So if you can stick to this throughout until Corona really leaves us for good, that we don't know when and where and how, but until then, it is our primary duty, a social responsibility for every one of us to stick to the COVID appropriate behavior, and also instill the same sense in whomever you see who are not following this. And the second most important is the vaccination. And those of us who have not received the vaccination, I would urge today, I would request you all today to please take your vaccination, and also take a major role in motivating others to take the vaccination. So this is the only precaution that you need to take to avoid not just the third wave, but 4, 5, n number of waves that the Corona might visit us in. So therefore, this is the only way to prevent COVID-19. COVID appropriate behavior on the one hand, and vaccination on the other. So, and he was also very he was asking expectations from the Rotary. Yes, expectations. First of all, I would ask all your prayers to end the COVID, not to have a third wave at all. I know when the Bible says, ask and thou shalt receive. But I know from Rotary, even without asking, I shall receive. So there, I'm very confident that I already did another meeting. To us, I had a different opinion about Rotary. It's not after the COVID experience where people just forgot their own. I mean, they came forward helping us each and every time, all the time. So I know they will be there, shoulder to shoulder, if at all there is a third wave, and I'm sure and hope fervently and pray that we do not see a third wave. So thank you very much. I've just given a bird's eye view about the third wave. As I told you, it's more a semantic. It's just a name. We really don't know if there's going to be another one. So you don't have to panic or fear that we may have a third wave. But we know now, unlike the first wave where we were unaware, and so much so for the second wave, we know we are prepared now. And so is every institution worth its name. And the government is all prepared, especially the government of Tamil Nadu. They're all prepared. We have not dismantled any of the services, facilities that we offered during the second wave. So it's all intact. In fact, anticipating a pediatric spurt or a surge, we've also had our personal trained. All of them have now gone for a training in pediatric intensive. Again, this is a matter of only abundant precaution and preparedness, not that it is going to strike and not that it is going to, our children are going to suffer. It's not that at all. It's only as a measure of abundant preparedness and precaution that we've done all this for the third wave. And as I have told you, maybe if you follow the COVID appropriate behavior 100%, and if you take the vaccine without fail, I'm sure there are not going to be any more waves. Thank you very much. And if there are any questions, I'll be more than pleased to take one by one.
For that wonderful and inspiring talk and lots of information for us. But at the same time, the chat box has been ringing with a few questions. The first question comes from Rotarian Anandan Shida, whether heart patient can take COVID vaccine, and then again from Rotarian Vijay Chodia, who asked whether a diabetic patient can take vaccination. Your thoughts, ma'am?
Yeah. Thank you. This, we've been hearing this time and again. There are absolutely no contraindications for vaccine. In fact, these are the people who should prioritize for vaccine. And that is why the government also rolled out for people with elderly people and people with comorbids right in the first phase. Just as they rolled out in January for the frontline workers, first the healthcare personnel, then the frontline workers. The third priority was for people over the age of 55 and for those with comorbids. So therefore, it's very imperative that people with comorbids must take it first. So heart disease is one of them. And so, or any other diabetes. Diabetes, definitely you need to prioritize and take the shot. So you don't have to think twice at all. Just go and get it.
Thank you, ma'am. We have the next question from Rotarian Kumaravel, who asks, when should we take the booster shot for both Covaxin or Covidshield?
Yeah, I really don't know what he means by the booster dose. If it's a second dose that he's talking about?
No, ma'am, there's been a lot of talk that people would have to take a booster after 6 months or 1 year because this vaccine might tend to become weak. So there's been a lot of thoughts floating out there that people will have to every 6 months take a booster dose, or once in a year we have to have a booster dose. So this is very much in line with that.
Yeah, correct. So booster is still in the talk stage. So there is no policy world over. Nobody has decided about when to give a booster, even though there's a lot of talk because the constraint of supply, even yesterday you would have heard it from the WHO, the constraint of supply, and they want equity of distribution across the world for people who have not even got their first shot. So therefore, this is being shelved, and maybe appropriately as and when the apex body, namely the WHO, based on recommendations from the experts, might decide on a third dose or a booster dose. Again, even if that is recommended, it is going to be only phased manner. So probably the priority group will get it first. Healthcare workers, then the elderlies, then people with comorbids, so on and so forth. So I think there's still time for all of us to wait, including us, for the booster or the third dose.
Okay. Ma'am, there's another question from Rotarian Karthikeyan, who asks, what about sinus patients, people who are suffering from sinus? What about, should they take the vaccine or not?
Not at all. There's no relationship between sinus problem and sinusitis and vaccine. Certainly, they can go ahead. So, if somebody wants more questions about the contraindications, there are only two absolute contraindications. Children before the age of 18, even that, the trials are going around the world. So, children below the age we have not given yet because they have not been tried on. And second is people who have definite history of anaphylaxis to vaccine. Anaphylaxis is a serious and a deadly reaction to any injection. People die within minutes. So that is called a severe allergic reaction. So those are the two absolute contraindications. Apart from that, there are no contraindications. So everybody else can go and get a shot. If you have any specific complaints, you can always discuss it with your family physician and get the clearance and go. But my only request is, out of presumption and assumption, I don't want anybody to delay their dose of vaccine. So sinus and all has no relationship whatsoever to the vaccine. You can go ahead and take it.
Thank you. There's a question from C. Lakshmi Narasimhan as to see about, you're given about the precautions of the third wave, but there is a huge fear in the minds of people, especially in the rural areas. What can be done to take over the fear of those people?
a fear about the third wave.
Yes.
The third wave in the rural.
Yes.
See, whether it is the social setting really doesn't matter. We still have people in the urban who fear. It's only probably a media-driven panic reaction. So, especially the social media, they read through all these messages that float in social media. Social media, as you know, is agog with a lot of unfounded news about the third wave, so on and so forth. So there's absolutely no reason to panic because we know now how it spreads, what causes this problem, and how to tackle. And the infrastructure is so strong enough, especially in Tamil Nadu. I can vouch for that it is strong, even in the rural setup. The infrastructure is even if they are infected, the hospitals and the taluk hospitals or even the primary health centers, the COVID care centers are going to take care of them one. And it is better they don't get affected. Again, the golden rules of COVID appropriate behavior and vaccination. Vaccination is being rolled out on a large scale, so they have not spread. It's not like it's being reserved only to the urban community. Even in the rural population, people are now willing. You can see it's so heartening and to see the people thronging the vaccination sites. Sometimes they even stage protests for a non-availability. So that's all very heartening to see. So once the vaccination is completed in the rural thing, I think the spread can be grossly contained. And there need not be any fear.
Thank you. There's a question in terms from Rotary Sundar. He's had a particular problem with his vaccine certificate where he's done both the doses, but he's got an error message to have the same number. He's asking where can he get it corrected? Any details on that front?
Just ask him to call me. I'll help him.
Oh, so sweet. In fact, I can add.
Just ask him to call me. Tomorrow we'll have.
So
see, these errors are likely to occur because this is a massive drive, right? So it's a nationwide drive. And in fact, we should be proud that it's so beautifully technologically driven, whether it's the Arogya Setu app or the vaccine-related apps. They've done a reasonably commendable job. So I don't think we can complain much about it. There can be errors. After all, it's technology, and you know how sometimes what happens, there's delay in either the entry or the app fails on that day. There's no connectivity. Something happens in those centers, and we do face. But that's relatively is a very, very small number. But I would be more than glad to help him if you have a number with him, so he'll be able to help him. Irrespective of the center he gets. Yes.
Thank you, ma'am. So, in fact, I will add a line there because, in fact, I had a problem with that. But I went to the primary health center. They were extremely sweet and actually got it sorted for me, and I got the certificate back from that. So, really, kudos to the teams working there. There is a question from Rotarian Balu Prakasham as to government is planning to open schools from 1st of September. How safe it is and what kind of safety measures to be taken for children in school?
Yeah, very, very good. I'm sure this should be the top of the minds of all parents who are planning to send their children back. But they should be glad that they're going back. What a lot of trauma they've all been through this 1.5 years. I think more than temples closing, it's the schools closing that really upset us all, psychologically, emotionally. So I think it's time we look into opening of schools. As far as schools are concerned, the government has given very clear directions and policy. They have prepared the teachers and the school management, the administration as well, about how to maintain all the COVID appropriateness in the premises, A, and B, about inculcating COVID appropriate behavior in children. And of course, they're not going to be lenient this time if there's failure in any of these. So, and parents also have the responsibility to teach their children and monitor their children about how safely they follow the COVID appropriate behavior. And thankfully, if everything goes fine, if the trials are, successful, we should have the vaccine shortly. Maybe by the end of the year, have for the age group between 12 to 18 years. That will come as an added relief. And more important, it's for the parents to ensure that they follow, because parents are role model for children. They have to follow the COVID appropriate behavior at home and out also. And they should not fail in taking the vaccination. The adults in the household where children go to school, if they take vaccination, I think half the problem is solved. So therefore, I think it lies the duty of the children, the parents for the school-going children, and the teachers. So it's very safe. You don't have to fear anything as of now. I mean, as a situation, and if the situation is going to worsen, I think the government is going to take appropriate measures in either calling back or whatever, which I hope would not be really required.
Right. Thank you, ma'am. Ma'am, there's a very different question here in terms of if somebody has to undertake an RT-PCR test, is there a interval that they need to have after their vaccination? Or how many days after the vaccination can one undergo an RT-PCR test?
See, RT-PCR test is done primarily to screen if you have an infection. So that can be either if you're symptomatic, then your doctor advises you to undergo a investigation, or for travel purpose. If you're going to travel, and if for any other regulations, if they ask you for an RT-PCR, you need to do it. So vaccine and RT-PCR really does not have any link whatsoever. As already told you, most of the vaccines none of them have the live virus. So it's not that you're going to secrete these viruses into mucosa or the oral cavity, and therefore cause any influence on the RT-PCR. So RT-PCR can be done irrespective of the date and days of vaccination.
Thank you. Ma'am, the Johnson vaccine has been made available right now in the primary health sector. What is your thoughts on it, and what could be the cost that people can be needed? And Rotarian Sri Krishna also adds that certain religious communities have been, leaders have been advising their people not to take up the vaccine. Your thoughts on that as well?
I think that's a very, very, very tricky and very sensitive question you're pulling into. See, these are the pricing and who will be given this and who the priorities. It's entirely up to the government. So those are policy decisions about, it's still, as you know, they've just approved, and the pricing is definitely going to be with the government. And about whether they're going to give it to the private sector, whether they're going to give it in the government as well, is all, it's too early to comment now, because we do not have anything solid from the government to let you know at this point of time. So therefore, I think I do not have a clear answer on that at this point of time. And as far as the religious says, I think we will not go into that. It'll open up a Pandora box. But all said and done, as a person from the medical fraternity who's been here for more than 3 decades, I think I would recommend that we do not miss out on the vaccines. That would be my very sincere and fervent appeal to everyone of you.
There are lots of questions still buzzing in, but I'll take one last question here from Rotarian Uday, which is like, what is your thoughts in terms of alternative medicines, in terms of homeopathy or Siddha medication, in terms of vaccination, and how do we counter that?
See, there are 2 aspects as far as alternative medicines are concerned. I just want to make a small correction in this. They are called CAM, or complementary alternative medicine. That is the accepted terminology. So they can only complement the scientific system of medicine called allopathy. To run it alone, you need to have a lot of solid scientific backing, which unfortunately these other systems of medicines lack. See, unlike allopathy, where millions of pounds of dollars are being pumped into for research, the alternative system unfortunately doesn't have. Not that it doesn't have anything good in it. Definitely there are going to be very good aspects of the other system as well. But as far as COVID is concerned, we can have it as an alternative, complementing the allopathic system of medicine, but it cannot take over a pivotal role in the management or in the prophylaxis of COVID. That would be my conclusive answer. And they have done wonders as far as, see, for instance, I had shown you the slides where we ourselves practice. So I think it should be a happy wedding of both. You cannot just run and say, I am superior. I mean, this system is superior. One should complement the other. The best of both worlds should be taken.
Thank you. That's a wonderful answer. And to take the proceedings forward, I'm going to request our very own PDG SVRM Ramanathan sir to address and do the felicitation of our speaker today.
Thank you, Harish. I do hope I'm clear.
Yes, sir.
Okay, thank you. I'm going to address in Tamil, as usual, okay? இங்கு திரளாக வந்திருக்கும் என் இனத்தவர்களே உங்கள் அனைவருக்கும் வணக்கம். First and foremost, first I thought I should congratulate my president. No, I'm not going to congratulate. I'm going to thank him. Thank you for getting this lady for clearing so many doubts, including me. என்னை பொறுத்த வரைக்கும் வாழ்வு ஆதாரமான்னு சந்தேகமா இருந்தது. வாழ போறோமா, ஆஸ் அ பிசினஸ் மேன், திருப்பி இன்னொரு லாக்டவுன் வந்துன்னா நான் என்ன ஆவேன்? இஎம்ஐ கட்ட முடியுமா? லோன் வாங்காத பிசினஸே கிடையாது. வேலைக்காரங்களுக்கு சம்பளம் கொடுக்க முடியுமா? நான் சம்பளம் கொடுக்கலாம், அவன் இருப்பானா? so many doubts. அப்படியே இந்த கோவிட் எனக்கே வந்தா நான் என்ன ஆவேன்? what happened to me? What happened to my family? இந்த மாதிரி பல பயம் இருந்து. Everything you have cleared it today, madam. It's simple. You have cleared everything. I should thank you and for clearing all the doubts. For the information of all the other presidents and members who are here, I would like to tell that we gave from Rotary Madras Central, we gave an award to madam. And normally when we give an award, we invite the recipient to our club and then give the award. But this time what we did, we went to the hospital and gave the award there. Why? It's a very big happiness for all the staff who came there, all the doctors who attended, to see their madam getting an award there. That's what I thought. That will increase the morale of everybody. And personally, this lady asked me, have you taken vaccination? என்னை கேட்டாங்க. நான் சொன்னேன், இல்லை எனக்கு கோவிட் வந்துட்டு போயிருச்சு, அதனால நான் என்ன எடுத்துக்கலன்னு. She had a worried face and tell, இல்லை உடனே எடுத்துக்க அப்படின்னு. See, I saw a mother in that. ஒரு தாயினுடைய பாசத்தை பார்த்தேன். இல்லைன்னா தன் உயிரையும் மதிக்காம இவங்க எல்லாரும் அந்த பிபி ட்ரெஸ், அந்த ட்ரெஸ்ஸை போட்டு என்னால அரை மணி நேரம் கூட இருக்க முடியாது. You will sweat like anything. அதோட உள்ள ஏர் கண்டிஷனர் வேற போடக்கூடாதுங்க. அப்படி இருக்க ஒரு சிச்சுவேஷன்ல எப்படித்தான் இவங்க இருக்காங்களோ. இது வரைக்கும் கிட்டத்தட்ட 1,60,000 பேரை காப்பாத்திருக்காங்க. இன் பேஷண்ட் அண்ட் அவுட் பேஷண்ட் ரெண்டையும் சேர்த்து. சோ அவ்வளவு பேர் உயிரை காப்பாத்திருக்காங்க. அப்போ அவங்க எல்லார் கண்ணிலும் இவங்க எல்லாம் தெய்வமா தெரியுறாங்க. They look like கடவுள், நீ கடவுளுக்கு மாதிரி எங்களை காப்பாத்துறீங்க, என் பிள்ளைய காப்பாத்துறீங்க, என் கணவனை காப்பாத்துறீங்க, என் மனைவி காப்பாத்துறீங்க, என் பிள்ளைய இப்படி ஒவ்வொருத்தரும் இவங்களை தெய்வமா தான் பாக்குறாங்க. ஆனா இவங்களும் எதையுமே பத்தி கவலைப்படாம, தன்னை பத்தி கவலைப்படாம மத்தவங்களுக்காக வாழ்றாங்க பாருங்க. நத்திங் லைக். இதெல்லாம் பார்த்ததுக்கு அப்புறம் முதலாவது எனக்கு நம்ப முடியல, ஒரு கவர்மெண்ட் ஹாஸ்பிட்டல் இவ்வளவு அழகா இவ்வளவு சுத்தமா இருக்குமா அப்படின்னு. ஒரு பிரைவேட் ஹாஸ்பிட்டல் பெட்டரா இருக்கு. அதனால நான் உடனே சொன்னேன், மேடம் உங்களுக்கு என்ன வேணும்னு சொல்லுங்க, நான் ஒரு 22 லட்சம் ரூபாய் தர்றேன் அப்படின்னு. அது என்ன கணக்கு? 22 லட்சம். அப்ப தோணுச்சு அந்த ஃபிகர், அவ்வளவுதான். அவங்க உடனே இந்த கோவிட் வந்து போயிடும், கொஞ்ச நாள் தான் இது சார்ஸ் மாதிரி, ஆனா பர்மனண்டா இருக்க மாதிரி நீங்க கேன்சருக்கு வாங்கி கொடுங்கன்னு சொன்னாங்க. நானும் வாங்கி தரேன்னு ஒத்துக்கிட்டு இருக்கேன். அதே மாதிரி என் மனைவியும் லாக்டேஷன் சென்டர் கட்டி கொடுக்க சொன்னாங்க, கட்டி கொடுக்குறவங்க ஒத்துக்கிட்டு இருக்காங்க. அதனால நம்ம எல்லாரும் நம்ம முடிஞ்சதெல்லாம் இந்த இவங்களுக்கு பண்ணணும். ஏன் தெரியுமா? ரோட்டரியுடைய எய்ம் என்ன? அதாவது எந்த வசதியும் இல்லாதவனை தூக்கி விடணும்னு. எந்த வசதி இல்லாதவனுக்கு 10 பைசாவோட வாங்காம இந்த மாதிரி வைத்தியம் பாக்குறாங்க பாருங்க, அவங்களுக்கு நம்மளால இயன்றதை செய்யணும். அதைத்தான் நம்ம எல்லாரும் செஞ்சுக்கிட்டு இருக்கோம். இன்னைக்கு இந்த நம்ம டாக்டர் ஜெயந்தி வந்து என்ன அழகா எல்லாத்தையும் எக்ஸ்பிளைன் பண்ணி சொன்னாங்க. எதை பத்தி நீ பயப்பட தேவையில்லை, நீ முதல்ல சுத்தமா இரு, சுத்தம் சுகாதாரம் தரும், நீ ஒழுங்கா இரு, தானா போயிடும் அப்படின்னு சொன்னாங்க. இந்த அருமையான பேச்சை கேட்பதற்கு நான் கொடுத்து வச்சிருக்கணும். நம்ம எல்லாருமே we should be happy. என்னை கேட்டீங்கன்னா ஹரிஷுக்கு ஒரு ரிக்வஸ்ட். ஹரிஷ், ஆர் யூ ஆன் தி லைன்? ஹலோ ஹரிஷ்.
Yes, sir, I'm there, sir.
Yeah. ஒரே ஒரு request. I hope you would have recorded this whole thing.
Yes, sir, it's recorded.
Speech. If possible, put it in YouTube for everybody who have not come. Highly informative. இந்த ஆக்சின் எவ்வளவு நாள்ல போடலாம், கோவிட்னா எவ்வளவு நாள்ல போடலாம், கோவேக்சின்னா எவ்வளவு நாள்ல போடலாம், அந்த மாதிரி அப்புறம் பூஸ்டர் டோஸ் வேணுமா வேண்டாமா, so many things. அப்புறம் இயர்லி தானா பரவும், முதல்ல இருந்து பார்ட்டிகல்ஸ், இப்ப இயர்லி மியூட்டன்ட், இயர்லி தானா பரவும், இப்படி எவ்வளவு இன்ஃபர்மேஷன் கொடுத்திருக்காங்க. இந்த everybody should know, if they come to know of it, we will save more and more people. So my humble request to our Rotary Club Madras Central President and Secretary, just put this in the YouTube and inform everybody that it's available in the YouTube. Any doubt, யாருக்கா இந்த சந்தேகம் என்ன பாருங்க. And of course, என்ன சந்தேகம் இருந்தாலும் on behalf of Dr. Jayanthi, I'll tell that நீங்க நேரடியா போய் நம்மகிட்ட நேர கேட்டு வந்துடலாம். She's such a nice woman. Okay, with these few words, once again, I thank Madam for having come here and explained everything to the court, to all of us. Thank you so much, Madam. Thank you.
Thank you, sir, for your very kind words. Thank you very much.
இந்திய செய்தி நாளைய வரலாறு. ஹலோ சிட்டி டிவியில் வெளியிடும் தகவல்கள் உங்களுக்கு உடனுக்குடன் கிடைக்க ஹலோ சிட்டி டிவியை சப்ஸ்கிரைப் பண்ணுங்க. மறக்காம பெல் பட்டனை கிளிக் பண்ணுங்க.